My name is Ni Ni Tun in complete. My background is HIV doctor, medical doctor, and my research is about looking for the HIV prevention and treatment strategy among the vulnerable population living in Myanmar. In Myanmar, HIV is highly concentrated among the key population. I call it key population, which means a certain group of population has high HIV burden, which is sex worker, MSM, transgender, and then people who inject drugs. And they are not only higher HIV incident, but also they have facing stigma, discrimination, and they are socially excluded. So my area is to find out the way to improve access to care among those populations. Currently, I'm working on the pre-exposure prophylaxis or HIV infection among the female sex worker and MSM, men who have sex with men, and transgender women. PrEP, we call abbreviation, is called PrEP. That drug is evidence-based, it's very good, but people has to take it. So in order to take the pill and to have accessibility, it is important to understand, can the people able to take it, or what are their challenges? And then that is main area of my research. I want to know what are their issues in order to take the pill. Then I want to improve the strategy. The big issue in my research are high-risk behavior, so HIV high-risk behavior. Many population of this vulnerable population, they are using more and more drugs. So drugs use and high-risk sexual behavior, that is important to be addressed to. And the second one is about mental health, because drug use and mental health, they are linked each other. So we have to also find out how are we going to support the mental health, especially during this conflict and crisis situation. And the last one, or not the least, is to prevent the young teenager not to become addicted to the drugs. How are we going to do it? These are the big main question in my agenda. I actually trying to focus on the population who are vulnerable and socially excluded. So they don't have a voice, they have no say. So my research, I trying to find out the strategy to improve access of healthcare to those population. So that I will also, on the other hand, advocate for those people to be seen and their voices are to be heard, and they will no longer be neglected in the community. So that is my aim. My research, I really think these research are very important and impactful, because we must scale up the HIV prevention and treatment services among those vulnerable population, especially during the current crisis with HIV high-risk behavior and mental health. So those are the areas that we need to address to, and I'm sure by doing that, we will save tens of thousands of lives.